Do you notice air sounds or coughing during intercourse? Do you feel that you are no longer as tight as you used to be? After childbirth, do you feel that intimacy with your partner is not as pleasurable as before? Do you feel less friction during intercourse? Or do you have difficulty keeping a tampon in place? Or maybe the most important question is this: do you feel that after giving birth, your body simply doesn't feel the same anymore? These concerns are very common, and in many women, they are not just psychological. They may be related to real anatomical changes in the vaginal canal, pelvic floor muscles, and perineal support structures. Today, I want to explain what vaginoplasty really is, who may actually need vaginoplasty, and why the correct surgical technique is so important. First, let's clarify one very important thing. Vaginoplasty is not simply tightening the vaginal opening. This is a very incomplete and sometimes misleading explanation. A true vaginoplasty is a functional and anatomical repair of the vaginal canal and pelvic floor support structures that may become weakened after childbirth, aging, genetic connective tissue weakness, or trauma. Especially after normal vaginal delivery, the issue is often not only at the entrance of the vagina. The support along the vaginal canal can also become loose. That is why many women describe symptoms such as a feeling of looseness during intercourse, air sounds coming from the vagina, a feeling of emptiness or reduced friction, less pleasure with their partner, difficulty keeping a tampon in place, a feeling that the vaginal opening is too wide, sometimes mild urinary leakage, and very often a loss of confidence. These symptoms may be related to vaginal canal widening, pelvic floor muscle weakness, or loss of support in the perineal area. This is why proper vaginoplasty planning should always start with an examination. In one patient, the vaginal opening may be the main concern. In another patient, the looseness may be deeper inside the vaginal canal. In another patient, the perineal body may be weak or damaged after childbirth. And in some patients, the pelvic floor muscles may not be strong enough to provide proper support. This is why one of the most important parts of a successful vaginoplasty is not only narrowing the entrance, but achieving a balanced tightening along the vaginal canal. If only the entrance is tightened, the vagina may look smaller from the outside, but the looseness inside the canal can remain. The patient may feel tightness initially, but the functional improvement may not be complete. So, the goal of vaginoplasty is not simply to make the vaginal opening smaller. The goal is to restore support along the vaginal canal within safe anatomical limits. A well-performed vaginoplasty should create a balanced, functional, and natural narrowing of the canal. Another critical part of the surgery is pelvic floor muscle repair. The pelvic floor muscles are one of the main support systems of the vagina. After childbirth, these muscles may become stretched, weakened, or separated. When this happens, women may experience looseness, a sensation of emptiness, air sounds during intercourse, reduced friction, and sometimes even mild urinary leakage. In a correctly performed vaginoplasty, the support structures are carefully evaluated. When needed, pelvic floor muscle repair becomes an important part of the surgery. Now, let's answer one of the most common questions I hear. Will I lose sensation after vaginoplasty? When vaginoplasty is performed in the correct anatomical plane or with preservation of nerves and blood vessels, loss of sensation is not expected result. In fact, when vaginal support is restored and the canal anatomy is improved, many patients report better friction, better confidence, and improved sensation during intimacy. But the key point is this surgery should not be performed by damaging nerves. It should be performed by repairing the tissues carefully in the correct anatomical layer, using nerve-sparing surgical principles. This is why vaginoplasty should not be seen as simple tightening procedure, especially in the hands of surgeons who only perform it occasionally. This operation should be planned by doctors who frequently perform vaginoplasty and who understand female genital anatomy, pelvic floor structure, childbirth-related tissue changes, and sexual function. Because success in vaginoplasty is not measured only by asking, "Is it tighter?" Success means the patient should not have pain during intercourse. Natural function should be preserved. There should be no loss of sensation. The vaginal canal should be narrowed in an anatomically balanced way. The pelvic floor support should be strengthened, and most importantly, should feel comfortable, feminine, confident, and safe in her own body again. Another common misconception is this: the tighter, the better. No, that is not correct. In vaginoplasty, the goal is not maximum tightness. The goal is correct tightness. If the vagina is tightened too much, it can lead to pain during intercourse, muscle spasms, discomfort, or even vaginismus-like symptoms. If it is not tightened enough, the original complaints may continue. That is why the target is different for every patient. A correct vaginoplasty is not a standardized, one-size-fits-all surgery. It must be planned according to the patient's anatomy. So, who may be a good candidate for vaginoplasty? Women feel vaginal looseness after childbirth. Women who experience air sounds or a feeling of emptiness during intercourse. Women who feel less friction or less sensation than before. Women who have weakness or opening in the perineal area after childbirth. Women who have difficulty keeping a tampon in place. Women with pelvic floor weakness, and women whose confidence has been affected by these changes may be suitable for evaluation. But I want to repeat this clearly. This decision is not made only based on symptoms. It should be made after a proper examination. Sometimes vaginoplasty alone is enough. Sometimes perineoplasty should be added. Sometimes pelvic floor repair is the most important part of the treatment. And sometimes the patient's expectations and anatomical reality must be balanced very carefully. The healing process after vaginoplasty also requires patience. In the first weeks, swelling, tenderness, pressure, pulling sensation, and discomfort can be normal. The tissues need time to settle. The muscle repair needs time to strengthen, and the final sensation doesn't appear immediately. In most patients, it takes several months to evaluate the real result. Full tissue maturation may continue for around 6 months, and in some patients, even longer. This is why vaginoplasty should not be seen as an instant result surgery. When planned correctly, it is a functional surgery that continues to improve as the tissues heal and settle over time. If you feel that after childbirth you are no longer the same, if you experience air sounds during intercourse, if vaginal looseness affects your confidence, if you feel less friction or less pleasure, or if you avoid intimacy because you don't feel comfortable in your own body, please know that you are not alone. This is a very common women's health concern. But many women feel too embarrassed to talk about it. With the right technique, nerve-sparing surgery, balance tightening along the vaginal canal, and pelvic floor repair when needed, vaginoplasty can help restore not only anatomical support, but also comfort, confidence, and quality of life. Vaginoplasty is not just tightening. When performed correctly, it is the restoration of anatomy, function, sensation, and confidence together.